problem to solve in the country. I took it passionately to solve the problem beyond money.
Nice.
In India, 36% of population having colorectal problem this given point of time. Doctor, you operated me. So I've seen your face, but if you show your back, I'll be able to recognize whether it's the same patient or not.
What is your break the ice moment with your patients?
I say we work where the sun doesn't shine. Come with piles and go with smiles. Collect the rat piles.
Collector usually deal with files. When does a patient should come to you if problems happen?
Whenever easy.
Colon cancers in young age is very common in the US. It's getting common in India as well.
Geocultural shift happening. See your kids what they eat, adolescent Gen Zs what they eat. Those guys bleeding. For them it is piles only. They give some injections, some powder, some acid, some the horn of a bullock. Spasm is sphincter spasm.
What do they do? How do they treat?
To the ring to the left hand and keep washing every day.
Are you serious? People are believing this?
Seriously.
Before we dive in, can I be honest with you? It blows my mind that 57.9% of you who listen regularly still have not subscribed to our channel. If you enjoy the podcast, the stories, the science, maybe even laugh at our jokes, could you do us a small favor? Hit that subscribe button. It takes only 2 seconds and helps us keep bringing you better guests and episodes every week. I'm truly blessed to have all your support and I'm sure you will support me in the journey. Now, let's get into today's episode.
Hello guys, welcome to another episode of our podcast series, Gut Feeling with Dr. Pal. I'm so excited to have such a humble person, Dr. Param from Smiles Clinic in Bangalore, very good friend of mine. He has done wonderful work and I know his hard work and how he has become so successful. So we talked about the most common problem, piles, hemorrhoids. We talked about constipation. We talked about colon cancer. If you are somebody who's looking for real, credible medical information from a colorectal surgeon, looking up for all the issues, including your gut health, this is absolutely the episode for you to watch. If you don't have the issues by yourself, if your family members are dealing with any of these issues, this is a podcast with so much information. I learned a lot as well. I'm sure you will as well. Let's dive deep into it. Hi, Dr. Param. Thank you so much for being the podcast.
Yeah. Paul, thank you so much. Gut feeling. I mean it. I had a gut feeling that someday I will sit with Paul and do a podcast. It's happening today in Chennai.
I'm so glad. I'm so glad. And your profile, I really wanted to interview you because you have done 50,000 surgeries.
Yes.
And you are one of the most popular colorectal surgeons in India, mainly in South India, in Bangalore.
Yeah.
Your clinic's name is Smiles.
Smiles, Smiles.
Before I know you, I thought it was a dental clinic.
Dental clinic.
Why did you name your clinic as Smiles for a colorectal clinic?
Okay. See, Dr. Paul, whenever I go for presentations, when I pitch for any workshop or a seminar or a investor pitch, Smiles Naka, they will think he is a dentist. Then I say, we make the other end smile. Only if the other end smile, there'll be a smile on the face like this, you're smiling. If the other end is frowning, how can you smile? Tell me. So the entry also should be good, the exit also should be good to make you smile. So that's why it is called as Smiles Hospitals. Some people make comments, come with piles and go with smiles. Smiles actually, initially, I was in Bangalore. Bangalore was Silicon Valley of India. Silicon Valley minimally invasive laser and endoscopic surgeries came to me. It is my own thing. Then Smiles we put it. As we picked up, they forgot that Silicon Valley minimally invasive laser endoscopic surgeries. Now they call only Smiles.
I really want to know, why did you choose this field of colorectal?
Colorectal surgeon. Yes. Even today I'm bullied every day for choosing colorectal. But I'm making many people smile every day.
Nice.
Why I chose this is, this was one of the biggest problems in the country. It's a big problem to solve in the country. I took it passionately to solve the problem beyond money.
Nice. I also know that you are treating people for free.
Yeah.
If they don't
Yeah,
if
any
they can't
people
afford.
with,
That's so nice of you. Not many
free,
people do that.
We do outreach activities. We
Nice.
do free of cost for many
Nice.
poor people.
Colorectal and also gastroenterologist. They have to be funny.
Yeah.
They have to be funny to break the ice to the embarrassed situation. What is your break the ice moment with your patients? What do you usually say?
I say, we work where the sun doesn't shine. The only people working on the planet where the sun doesn't shine is rectal region. Clear? It so happens that I have operated so many people, and they say, "Doctor, you operated me." And I say, "Boss, I've seen your face, but if you show your back, I'll be able to recognize whether it's the same patient or not." Many a times it has happened to me.
So, like all these diseases that we are talking about,
yeah.
it could be hemorrhoids, piles, fistula,
Yeah.
constipation, rectal bleeding. All these are like embarrassing diseases that
Yeah.
people doesn't want to come up.
Yeah.
Right? Do you think that is the reason for delayed diagnosis?
Yes. See, you said it is embarrassing, no? I'll tell a story of one collector in Karnataka. Collector had piles. Okay. Collector did not want to share with anyone.
Collector usually deal with files. Very bad joke.
You know what I tell them? Boss, if you sit on files for a long time, you will end up getting piles. Correct? They will sit on files. They will not clear it. They'll end up getting piles.
So you proceed with the story, sir.
So this collector, he didn't want to know that in the district, or a district like collector, he didn't want to know that he had piles. So what he did, he did not come with official driver. He hired a private taxi, private driver. He came all alone to hospital. Before coming, he messaged me, "Look, I'm coming. Don't tell anyone that I'm collector." Okay. Number one. Number two is, you have any backdoor entry, I'll come to that entry. Nobody should know that I'm a collector. So he came, backdoor entry, operated, and went back. He says, if I come to know that I have piles in my district, whole district will bully me. Collector has got piles, collector has got piles. So it is that embarrassing.
I see.
Yeah, that's number one. As you said, there are a lot of shyness, stigma, taboo attached to piles, fissure, fistula. What, in my experience, in the 80s when HIV, was there, people think this is also sexually transmitted. They assume it is sexually transmitted, and they don't share with anybody in the family, mother, brother, sister, or anyone. Because before it becomes too worst and it will become unbearable, then they share and come to hospital.
So all these embarrassing situations, at least in piles, they come with grade 4 or some disease. You in the hands of a good surgeon like you can operate. But with colon cancer, if people delay the diagnosis, then it could spread and everything. Do you have any stories like that?
Plenty I have.
Plenty I have. What is the youngest colon cancer that you have seen in India?
23 years rectal cancer.
23
years rectal cancers. Incidence of rectal cancers is increasing in younger population. American College of Colon and Rectal Surgeons says there'll be 30% increase in colon cancer by 2030 in 30 years age group.
Wow.
This will happen in India in next 30 years if we don't do intervention. Clear? So colon cancer, misdiagnosis. There are plenty of people, if they have simple bleed, they'll end up with a quack.
You're talking about blood in stool.
Blood in the stools. Lower GI bleed. Blood in the stools.
Rectal bleeding.
They will end up with a quack. There are 1.5 million quacks in the country. Published in European Journal of Coloproctology.
In India.
1.5 lakh quacks. Imagine. In the name of Bengali doctors, with due respect to religion, some religious people practice this work. Those guys bleeding, for them it is piles only. They give some injections, some powder, some acid, some thread. The horn of a bullock. If the spasm is sphincter spasm, they push it inside and widen it.
Are you serious?
Seriously.
So they're taking a horn of a bull.
Horn of a bull to dilate the sphincters and pushing it inside.
Oh my God.
And once it so happened, they pushed up to the sigmoid and there was perforation.
It's a hole in the colon.
Yeah, they came to me. Then we fixed it. Then another story, like Quack story only. One of a school teacher from my village, own village, he has gone to him for 2 years. Sir, piles bleeding. He has gone, given some pounders, nothing happened. He has gone to qualified MS surgeon doctors also. They also prescribed some lignocaine, topical.
Ointments.
Somebody told you go to Parameshwara. He is from village, he'll see very well. When he came, I just put my finger. It was a low rectal growth.
Cancer.
Yeah. One more interesting story I want to share. An IPS officer from Karnataka, young lady, conceived. And she had pain. Whenever she went to gynecologist, the pain is because baby is growing, baby is putting his foot and it is moving, shaking, that's why pain. Every time she has gone, she has told, I've got pain. Radiologist also says it's because focus will go towards baby now.
Correct.
They will not think any other thing.
Correct.
Finally, baby was delivered and the pain became too much. That time they do not colonoscopy, CT scan with contrast. There was a splenic flexure growth in advanced stage.
Wow. Colon cancer.
Colon cancer. So,
How pregnancy means she should be like 30, 35?
she is 34. She
34.
was 33 and half.
What
Now
about-
she is 36 now.
Are you serious?
Very big surgery. We did a salvage procedure, and thank God she's doing great. She's disease free at the moment.
So, I thought, Param, that colon cancers in young age is very common in the US. We see this all the time. So you're saying that it is getting common in India as well.
Yeah, there is geocultural shift happening, What US did in the past, we are doing it now. You see your kids, what they eat. Adolescent Gen Zs, what they eat.
So your food can increase the risk of colon cancer.
You are the gut specialist. You've spoken tons about this. And food can really increase the risk of colon cancer. And believe me, the only cancer which is diagnosed late in the country is colorectal cancers. As per ICMR report, 78% of colon cancers are diagnosed late,
Wow.
where we can't do anything about it. Sort of 100 people, 80 people will die like that. Okay? So it's a very serious problem actually.
So let's say 100 people coming with colon cancer, I'm just saying. You were telling me that right now in India, 80 people,
78
you are not able to save them.
No.
Because they come late.
advanced stage.
Because I know the US statistics that, when they come early, the treatment is great.
Great.
Like
you know very well now.
Good surgeon like you,
Yeah.
you just remove the growth,
Yeah.
you connect it back based on the location.
Yeah.
And if chemo radiation is needed, it is a very good prognostic disease.
It's one of the cancers, if diagnosed early stage, can be completely cured, and we can give normal life expectancy to the patient.
Wow.
If diagnosed early.
If diagnosed early.
Why it is not get diagnosed early in India?
They don't seek medical attention?
I'll tell you one thing. Indian government is great and they're doing great work. There are many awareness programs, blindness eradication program, oral cancer program, cervical cancer program, breast cancer program. National programs are there. There is no national program for digestive diseases. There is no national problem for colorectal problems. In India, there are 36% of population having colorectal problem at this given point of time.
So you're talking about like 1 in 3 people
Yeah.
have some kind of colorectal issues.
And 50% at least experience once in lifetime. Maybe constipation, maybe a fissure, maybe a bleed, maybe a lower, something will they'll experience 50% at least once in lifetime.
Once in lifetime.
It's a big problem actually.
So we talked about delayed diagnosis.
Yes.
When does a patient should come to you
Yeah.
if problems happen for them?
Yeah. People, according to me, see, for us, we know what is lower GI bleed, upper GI bleed. For a common patient, whenever he sees bleeding in the stools,
Blood in stools.
Blood in stools, red flag. They should come. Along with this, if there is alternating constipation, alternating diarrhea, mucus in the stools.
So explain about the alternating constipation diarrhea. So sometimes you will be constipated.
Sometimes
you'll have loose
diarrhea.
stools.
Okay. And the diarrhea will be mixed with the mucus or blood.
Mucus, how do you explain to a patient?
Mucus anaka, we will tell, if they are from Tamil Nadu, they will tell in Tamil language that whitish nature, the gonde madri varudilya.
Chali mari.
Chali madri varudu. Kannada we tell gonde madri. Jelly type.
Jelly type.
In Andhra we tell, for them it is pappu. Chima. They tell chima in Andhra.
I see.
So we ask whether it is if there is a mucus.
Okay. In the stool.
Constipation, diarrhea, mucus, bleeding, loss of appetite, loss of weight, and if there is any history of colon cancer in the family. So when all these things people have, they have to seek medical help immediately. They should not wait for all these things to happen. A simple bleed, a simple loose stool, a simple pain abdomen these days, one should not neglect. We have to address it comprehensively. Detail apdi.
So we talked about symptomatic patients.
Yeah.
Blood and stool.
Yeah.
How about I don't have any symptom?
Yeah.
But I'm concerned that I may have colon cancer. I am 45 years old. No, I'm not. I'm just saying.
You are 30 years younger than that.
I'm, let's say, 45 years old.
Yeah.
I come to you.
Yeah.
What do you recommend? You recommend colonoscopy or stool for occult blood testing? What do you do?
Yeah. When a normal 45-year-old young person comes for a master health checkup, he's also very, very keen on his biomarkers. Everybody these days asks, sir, cancer ki dana test irka?
Blood test.
Blood test irka? Yeah. If a 45-year-old comes, we'll go ask a detailed history of the patient. We spend solid 30 to 40 minutes with the patient. Detail we'll ask him.
But I want to confirm that there is no blood test to diagnose cancer.
There is no blood test. Only you can do occult blood.
Occult blood.
One is marker, CEA.
Yeah, so I'll explain that occult blood to audience. Occult means hidden.
Hidden blood.
Hidden blood.
Hidden,
which means that your stool will be normal.
Yeah.
But there might be some microscopic blood in the stool. So you take the stool sample, look at the microscope, and then see whether there is any occult or hidden blood in the stool.
In the stools.
If that is positive, then you do a colonoscopy. Super. I have had patients where they say my stool is black like my hair. Should they be concerned?
Very much concerned. So I call this anus as window to the GI system. Peep through this. You can go up to mouth. Got it? So if there is any upper GI bleed, I mean above the small intestine, if there is any bleed due to the esophagus, that stool will mix with bleeding will mix with the stool and come out as black colored stools.
Correct. I have had patients where there are ulcers in the stomach that can bleed and the bleeding can come as black stools.
Black stools.
But in your field, black stool can also be a sign of colon cancer.
No. In colorectal cancers, frank blood.
Rectal bleeding. Let me ask you, I think patients are concerned about the rectal examination. They are feeling that if I have a problem, if I go to a doctor, he's going to put his finger in my anal orifice. It's going to be very painful. What is your take on that?
Yes, many people come with this notion that they go to put the finger in the anal canal orifice and it should be very, very painful. Here, yes, it is true. But it all depends on the doctor who consults. If he's very empathetic, get the confidence of the patient, then he'll be ready to put finger anywhere, not only in the anal orifice. Got it? It's a painful one, but there's a technique to do it without any pain. One. If there is tight spasm, muscles, you said muscles, right? Muscles are very, very tight. We will know it is tight and will not go inside. Imagine there is an abscess between the muscles. Then also it is tight and painful.
Like a pus collection.
So it's a very painful thing, provided if it's got an intersphincteric abscess and a tight muscle. It will be very. Otherwise, comfortably your finger will go comfortably scope will go. I'm sure you must have put many scopes from below.
Yeah. I personally feel that that impression of being very painful is not as much as what people think.
Not at all.
We do apply lubricants.
Yes,
and we make sure that you are in the right position.
Right position.
Like a
left lateral position.
Correct.
Yeah. And one more thing,
with your right leg up.
Yeah. See, bringing the clothes down, maybe for a male or a female, it's very embarrassing in any hospital setup. Correct? When you come to Bangalore, come to my clinic. I will show you how rectal examination is done.
Is that right?
Nowhere it is done like that. Lot of privacy. They don't expose any of their parts. We use disposable drapes to cover them. Disposable bedspreads. Because it's dirty, right?
Correct.
Somebody may,
Correct,
some stools there.
correct.
So when you come to our clinic, I'll show you how we do it. So it is not as painful as what people think. Clear?
Correct. That's one of the most important thing about convey.
That's very clear. It's not painful. But many people come with bad pain. They can't even sit.
That's a different story.
That's a difference. There we should not put finger.
Correct.
Never give put finger. Sometimes people have put finger, patients have died.
Yeah. I've seen that.
Got it, huh? Vasovagal.
Vasovagal. Yeah.
So it's not painful at all.
Right.
Relax.
Now moving on to the next big colorectal problem, which is piles.
Piles, yes.
So I did a viral video on COVID. That's what my introduction to social media.
Social media,
I didn't plan. It was an accident.
Yeah.
And I said I was a gastroenterologist.
Yeah.
And one relative of me called me and then said, your video was amazing. They said you are a gastroenterologist. What does gastroenterologist mean? Then I said, I deal with upper GI, lower GI and all those things. She didn't understand. She said, அந்த போஸ்டர்ல மூலம் பௌத்திரன் போட்டிருப்பாங்களே அந்த டாக்டர் தான் நீ நான்
அந்த டாக்டர் தான் நீ
the poster on the railway station, that doctor only know.
See, I'll tell you something. These posters are there on the railway stations, bus stations, gullies. One day cure, no surgery, no cut, no pain.
For piles.
Go back in 1 hour. Where go back in 1 hour? Mele 1 hour. I've seen patients died going to quacks.
So you were saying these are the quack.
Quacks, 1.5 million quacks in the country. Nobody is there to regulate them. Piles is the biggest problem. If you say piles, people will laugh at you.
Yeah.
That's the problem. Okay. Piles is so interesting. It changed the course of world history. Napoleon, he lost his battle of Waterloo because he had piles. He could not sit in the horse and go to the war and lead his team. He came back and slept in the tent. He lost the war and it changed the course of the world.
Is that right?
History. Yeah, true.
He should have gone to the loo. He should have gone to the loo in Waterloo.
Loo in Waterloo. To the loo.
In medical term, it's called hemorrhoids.
Hemorrhoids.
What is piles?
Piles piling up of blood vessels. Anal cushions are there in the anal canal. Because of friction, because of constipation, because of old age, maybe because of cirrhosis of liver, this will bulge in size. That piling of blood vessels is piles.
So that area is supplied with blood vessels. Because we talked about how important that is.
Yeah.
So piles is a condition where the blood vessels gets bigger.
Yeah, bigger. Okay.
What can these dilated blood vessels do? What are the complications?
See, grade 1, okay. The pile is inside. Grade 2 means the pile will come out of the anal canal and go in.
They can actually see a growth outside.
It will come out and go in. Grade 3 is it will come out, it will not go in. They have to push in the hand.
I've seen that as well.
Grade 4 is it will come out completely. Even if you push, it doesn't go inside. That is the time you lose battles in life. Right? People have bled to death. Seriously? In the villages. Bleeding and hypovolemic shock. Sometimes we see patients with hemoglobin 3, 4, 5 coming, sir, I've got
because
piles.
The blood vessels keeps bleeding. Hemoglobin
See,
goes
whenever
down.
you pass stools, friction opens up, bleeds. That's all. So this is lower GI bleed due to piles, it has bled to death in villages I have seen actually. Yeah, I come from a typical village background. That's what it is. Yeah.
And then it can also, so let's say I have constipation. Should I have to come to you as soon as I have pain in that area?
Exactly. See, people, anything they have in the anal canal, pain, bleeding, burning, itching, swelling, abscess, predominantly about 75 to 80% come, sir, I have piles. Anything in the anal canal, people think it is piles. Your question, I have constipation and pain in the anal canal.
Correct.
You have to seek medical advice. That pain can be anything. It may be as simple as a fissure.
Right.
It may be as complex as a rectal cancer.
So I'm going to argue with you from the Quack standpoint.
Quack, sir.
I'm going to say that I put the poster. I spent like 1 lakh for putting that poster.
Okay.
I am treating that patient. I'm not sending it to you. What do they do? How do they treat?
Quack, sir. See, there is one village in Karnataka. There is a quacker. That quack will give a silver ring. Silver ring. 25,000 rupees. You will only give. Purchase from him only. Put the ring to the left hand and keep washing the anal canal every day. He says piles will go in 3 months' time.
Oh my God.
This one quack does this.
I think the ring will go.
Ring will go sometime inside.
So the patients, are you serious? People are believing this?
Seriously. In a small place, Taluka, you will find at least 150 quacks.
Wow.
1.5 million quacks are there in the country.
How about in metropolitan city like Bangalore?
In around my Smiles hospitals, I have 25 people. 25 people. I'll add some interesting thing to you. How is calculating? Quacks economy. 1.5 million quacks. 15 lakhs. Each quack will make about 20,000 per day comfortably. Even if he works for 25 days per year, it comes to about 6-7 lakh crores.
Wow.
It is double the budget of Karnataka.
Wow. So what I'm asking my audience to say, to know is that let's say you have all these low GI problems.
Yeah.
I think it should be taken care by a specialist.
Yes.
And I think referral to colorectal surgeon like
Yes,
you or
yes,
any other
yes,
people
yes.
who does really good job is absolutely needed.
Yes.
So when I come to you,
Yeah.
how do you treat piles?
Haja, me, okay, treating piles when people come to me. See, there are different techniques to treat piles. We should choose a technique which is very safer to the patient. Patient safety is important, right? So we treat in lasers actually. We treat in lasers, the most advanced, painless, and it's almost bloodless, and it's a daycare procedure. They come in the morning, go back in the evening. Next day, 90% of the people go to hit the gym, exercise, walking.
The next day onwards.
Remaining 5% with complications and all these things, they take about 15 days, 1 week to go back home. But 95%, they go back home on the same day. We do laser procedures for piles.
So
Laser.
laser is a
Light.
It's a device.
It's a light amplification. Laser is light amplification. Through that, it's also a form of energy, like electrocautery, like harmonic. It's also energy. So through that energy, we make the pile mass circular to shrink.
Shrinks right away?
It shrinks right away, but for the edema to come down, it takes about 2-3 weeks. Yeah. Shrinks right away. On the table, it shrinks. Yeah.
On the table?
Yes. There'll be post-op edema. And after operation, swelling in the process of healing. It's called edema.
Correct.
So that will be there.
How long does it take, the procedure?
My procedure? Laser. Well, it takes about, my expertise, just not more than 10 minutes.
10 minutes?
Yeah. For the 10 minutes procedure, I worked for 30 years, boss. 30 years I've studied for 10 minutes work.
It's like Usain Bolt.
Usain Bolt.
For one minute.
Like we are also like that, no. 30 years we have read to do the 30 minutes work.
How many of this you might have done?
50,000 plus. Wow. And to add to this, in the last 5 years, I have operated 6,223 fistulas till yesterday. I've got the database to show you.
Wow.
Fistulas, which is highest in the world.
So one quick question on prevention. How do you prevent piles?
Prevent piles, Sir, I was, last 2, 3, 4 months in India, something is trending. work for 70 long hours a week. Somebody says work on a Sunday also.
Yeah.
I totally endorse them. Yes, we should work for 70 long hours, work on a Sunday also, which I do. But don't sit for a long time in a place for more than 1 hour.
More than 1 hour.
70 hours, if you sit and work, he will end up in smiles.
Sir,
Long sitting hours is one of the causes.
can you explain to me why sitting more than 1 hour can cause piles?
Because of gravity. Animals don't have piles. Human beings, two-limbed. Gravity, they'll develop piles. When they sit, these fellows, IT professionals, they don't drink water, they don't eat food. Even if they eat food, online order pannitange. They table, they will do pizza, burger, Domino's, all those things. Lifestyle, sitting in a place for a long time, eating food with less fiber, eating junk food, eating roadside food, and putting pressure while passing stool, spending too much of time in the washroom, mobile, iPad.
So using mobile in the bathroom can worsen the constipation and increase the risk of piles?
Yes, because they sit for a long time. Because of gravity, it keeps on going down, the pressure. You know something, even I start my day with mobile in the washroom. You know what kind of messages, sir? Sir, you operated me 15 days back. My stool is thin. My stool is hard. My stool is red. My stool shape is changed. Little stool I'm getting, but I'm happy. Early morning messages are these messages for me. In my washroom, I message about their shit.
They say good morning.
Yeah, that's a good morning. That's my morning routine. Morning routine, okay. Second thing is, you asked me causes, no? There are a lot of things trending in social media about morning routine. Morning routine should be relaxed, reading, yoga, gym, playing, all these things. People are trying to pack too many things in 1 hour. So disturbed morning routines. Then these youngsters I have seen in this time, why piles you told, no? Prevention. Many people go to this gym, bodybuilding.
Correct.
Muscle building. They come to me and tell, sir, I take some whey protein, some protein bars, some protein shakes, some creatine, protein wafers. Every fellow taking this has come with me to piles 100 out of 100 people.
So in your experience, this protein supplements increase the risk of piles?
Not only piles, imagine you are a gastroenterologist. The protein supplements, not only piles, it will impact the whole system.
So I'm having a different take on this. Yes, it can cause hemorrhoids and piles because it slows down the GI motility. Because most of the times what happens is people will not be able to handle that much amount of protein.
Exactly.
But the protein requirement is already very low in Indian community. We do recommend, like if you are not able to meet your protein requirement through whole foods, it is okay to take protein supplements. But the most important thing that what I see in my practice is they develop constipation.
Constipation leads to piles. Constipation is the mother of all diseases.
Correct.
Constipation. Constipation anaka, I think of a movie. You know Amitabh Bachchan?
Yes.
Pico movie pathirkingla, Pico. In the movie, the whole story is about Amitabh Bachchan's constipation. He will call his daughter, मेरे को थोड़ा पतला है अभी, मेरे को थोड़ा बड़ा है अभी, कलर थोड़ा येलो हो गया, कलर थोड़ा ऑरेंज हो गया. You know, at the end, even they go for a trip, they carry that commode on the car and carry. In the end, he will go to the washroom. He will pass his bowel peacefully.
Correct.
Then he said, today I'm accomplished, I'm happy. And he dies. So constipation is one thing which will disturb every human being in his day-to-day activities.
Yeah, of course.
If it doesn't move the bowel, day is gone.
Of course.
Next.
Of course. That's, I think, one of the most important point is in protein supplements, in gym building, muscle building, one of the most important thing is constipation. It's a side effect of all these protein supplements. But if you get it, either you decrease the dosage of the protein powder or you increase the fiber intake and seek medical attention if you have any constipation. Super, sir. So one thing that we really want to focus upon is women's health. Many people, especially in your practice, you must have seen colorectal issues like constipation,
very common,
after childbirth. Is there any relation between childbirth and postpartum?
You asked me a very, very, very good question now. See, out of 10 women who come to my clinic, 6 women they say I have piles. And they say I was operated earlier 2 times, 3 times, again I'm getting. See, what happens during delivery and childbirth is, in India, you know the stature of women. You know the nourishment of women. And if there is a big baby, more than 3 kgs, and if it is a full-time normal delivery, delivered in villages, delivered in home, delivered in institutions, people insist on normal delivery, normal delivery. Yes, good it is. But while delivering that 3.5 kg baby, 3.8 kg baby, narrow pelvis narrow, the baby comes out of the birth canal. While coming out in the pelvis, in the front you have urinary bladder, in the middle uterus, I sit in the back.
Correct.
My area is in back. So when they, after delivery, what happens is they started developing constipation. They will not pass stools for 1 or 2 days, and it's very difficult for them. Some people put their finger and remove the stools. Some people do this kind of manipulation. Some people go to different doctors. They keep on changing laxatives. Nothing works. Why? Along with the birth canal, the rectum has come down. It is called as intrarectal intussusception and rectocele.
So the rectum is coming out of the...
Rectum within rectum, intussusception. Okay. And rectocele. Along with that, urinary bladder also comes down. Because of childbirth, poor mother has to pay a heavy price for a normal delivery. Cystocele, there is incontinence for urine. Stress incontinence, urge incontinence.
So you're telling that prolonged labor,
Right? Obstructed labor. Prolonged labor. Big baby. A delivery by trained dies in the villages. Delivery by untrained dies. In fact, in the hands of a very, very good professional also, delivering a 3.5 kg baby, 3.8 kg baby is not easy. So this will bring down the pelvic floor relaxation.
So this is why they say they will offer C-section, and then people say that you are offering C-section for money. So that is the discrepancy. So prolonged labor can cause colorectal issues, and they may come to you after the procedure, after the childbirth.
Yes. I'll tell a story. One lady came to me. She was an executive engineer in government of Karnataka. The moment she sat on my chair, she started crying. Sir, 41 years, sir, I have not passed comfortably, sir. 41 long years. Every day I have to remove it, sir. I met 23 doctors, sir. My husband has given up on me. There is a saying, every day if you cry, every day people die, who will cry for you? There is a saying like that. She came alone and started crying. When I went into her life, this was the problem. Then we did an MRI diffugram. We saw there was a rectocele. We saw there was a cystocele. We did a repair of pelvis, rectum. Next day morning, sir, 41 years I passed my stools comfortably, sir.
Nice.
You are my God, sir.
Nice.
This issue of obstructive defecation syndrome, it is called. It is not addressed by any, maybe few colorectal surgeons in the country diagnose that and address that. Why? Means because there is no proper training. Including me, I didn't have proper training in the undergraduate days and all. So, women develop during pregnancy also. Why? Because of iron supplements.
Iron supplements can cause constipation.
Yes. So when it causes constipation, it can cause fissure.
Correct.
When it causes fissure, repeatedly, it can cause sentinel piles. When there is a fissure, they can get an abscess. So the repeated constipation, they can get piles.
So you have seen colorectal issues during pregnancy?
Yes. During pregnancy, mothers come and tell.
Do people come to you?
Yeah. Sir, abort it, sir.
Abort it?
Yeah. Abort it. There is a story. A lot of stories on our channel. Sir, abort it, sir. I don't want, sir. I can't take this pain.
Because of the rectal pain, the mom is asking to abort the baby.
Yeah.
That's how painful it is.
This is how people have told stories on the channel. That painful it will be, yeah. Even our enemies should not gain that rectal pain.
Yeah, of course.
I don't have enemies. Okay, they say that. Okay. So, during pregnancy, one is iron supplements. Second thing is progesterone hormone increases. There is vasodilatation.
Correct.
Already existing piles, it will exacerbate. Then, the fetus pressure going up to the anal canal.
Correct.
So, all these three factors during pregnancy also, it will increase.
So one thing from a gastroenterology standpoint, we always say the fiber intake should be like 35-40 grams per day, especially during pregnancy, to make sure that they doesn't have constipation. But more than that, they'll promote the good gut bacteria. When the baby comes from the vaginal canal, it will swallow Swallow
You
the-
said no. I saw your wellness program. Wellness begins in the womb.
Correct.
I tell wellness is from womb to tomb.
No, of course. That's why you can prevent illness. That's why you can
You
prevent
bacteria,
illness.
gut bacteria. From there, it starts to prevent any kind of Alzheimer's, Parkinson's, anything you name. That's how it is. So pregnancy, during delivery, post delivery, women have got issues. If any woman has got these issues and has got piles, we have to think in. We go to deep into the life and ask, normal delivery, weight, what is the weight of the baby? What time you entered hospital and what time you got delivered? If they tell, sir, I took 24 Sanaka, guaranteed prolonged labor, obstructed labor.
Problem with the defecation purpose.
This is with women, yeah.
Wow. Sir, we discussed a lot.
Huh.
It was wonderful.
Yeah.
It's wonderful. Is there something that you have to tell my audience so that they don't come and see you? Every.
Ayo. Tell my audience so that they
will not have any colorectal problems.
They don't come and see me. So they should always keep smiling like you. So one thing is very, very clear. Eating proper, nutritious diet. Consuming good amount of water. Eating fruits, vegetables and fibers. Not to strain while passing stools. In case if they pass hard stools, releasing it slowly. Correct? And sleeping well, solid sleep. Very, very important. If you don't sleep well, brain get access, thakar, circadian rhythm out. Sleeping well and good physical activity. All these things are under control and which are all free.
It's so nice of you. It's a wonderful discussion. I think more than the discussion, you are such a nice person. And I could clearly see that where you are came from pure hard work. You're an inspiration to many of us, including me. And I hope that after this podcast, any patient who has this colorectal issues, I really wish that they go to a colorectal surgeon. And then you're doing some good work, and that needs to be emphasized and raise awareness about as well. Thank you so much for your time. I had a wonderful time.
Thanks a lot. It was my in the bucket list for many years, and I had a gut feeling I will meet Dr. Paul and have a podcast with him. And one message is: anybody who is poor, anybody who cannot afford, we never send them back. We do free of cost and send.
That's so nice of you, sir.
Clear.
That's so nice of you.
Okay.
Thank you so much, sir.
So thank you so much for the invitation.
Thank you, sir.
Spending time with you was a real pleasure, and it's a day for me which can never, I can't forget this in my lifetime.
Super, sir. That's so nice of you. Thank you, sir. That was a wonderful, wonderful podcast. Such a nice person. I'm sure that you have learned a lot. Please write down in the comment section in terms of what you learned and what will you change in your lifestyle after listening to this podcast. I just don't want this podcast just to be like a 1 hour long without having any digestible information. So I want you to imbibe that information, write down in the comment section or even in your notepad or something. So listen to it and then make sure that you practice in your general lifestyle. I'm sure that you will definitely make your gut happy, stay stay gutsy. May gut bless you.